Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about patients' rights and responsibilities. This could go on forever, but this is just going to be a very quick video to give you kind of an idea of what is regarded when people talk about patients' rights and responsibilities. This comes up a lot when it comes to HIPAA, when it comes to patient confidentiality, and I think people hear the patient rights and responsibilities, but they don't really maybe understand what it is, or they don't look into it, or they don't think about it. So I just want to put it out there because I have seen that this is something that is searched a lot online, and it's very simple. You can get into the nitty-gritty parts of it, which I've done videos about, minors and confidentiality and things like that, which definitely do play a role, but this is just going to be a generalized video. Patients' rights and responsibilities. So let's start with patient responsibilities. Patients have the responsibility to be honest with their caregivers. They have a responsibility to be honest, truthful, thorough with anybody who is going to be taking care of them. It is because you, as a provider, doctor, someone who is participating in their care, is not going to be able to do the best you can for them without this knowledge. Patients do have a tendency to not tell the full truth, especially when it comes to substance use, alcohol, smoking, exercise. And it's because there's so many stigmas around these topics, right? There's so many judgments that people have if you're a smoker, if you're a drinker, if you don't exercise. And so people are embarrassed to be honest. And also, patients have had poor experiences with providers lecturing them. And even though the intentions usually are good, of course, you care about the person, you want them to be healthy, you want them to be aware of what they're doing to their body. People know what they're doing to their body. They don't like to hear it. It's a very fine line for healthcare professionals to be able to educate the patient, show your concern, and how to solve that without making them feel like they're being judged, lectured, whatever. So that is one of the things that people don't realize, that healthcare providers can only help them as patients as much as they allow them to help. And I think that gets missed in communication to patients by healthcare professionals. I think they just jump into conversations. They don't preface things with that kind of information, and people jump on the defensive right away with certain questions, such as those that I've given examples about. So yes, although it is patient responsibility to be honest, thorough, and everything else when it comes to their medical histories, their current medications, their current lifestyle habits, etc., it is also the responsibility of the provider to make them feel comfortable to be honest about that, so you can be as helpful as possible. So there's the patient responsibilities and how it ties together with healthcare professionals. And I think we forget about that a lot as healthcare professionals, that yes, we're supposed to, quote, preach the healthy stuff, and we're supposed to let people know and tell them they need to quit smoking and you can't drink that much, but I think we forget the human side of it. And so just think about that as you put into practice with your patients of how you approach these topics. Okay, so patient responsibilities are there. Patients' rights. Patients have the right to refuse anything. You can propose whatever you want. You can suggest whatever you want. You can be very honest with them and give them the very dreaded, grim outlook on things. But ultimately, it's the patient's rights to choose if they want to do treatments, how they want to do treatments, what kind of treatments they want, if they want to do some kind of customized. And it's your job as the healthcare professional to try to accommodate that as much as possible. It is your job, whether you agree with it or not, to respect the patient's rights in those decisions. I have always told my family that if I was to be diagnosed with a very terminal illness, even if they don't give me a terminal diagnosis in the beginning, pancreatic cancer, for example, I've lost many loved ones to it. I have not seen anybody personally survive it. I know it's possible. It's just not a high probability. If I was diagnosed with that, I'd probably not do most of the treatments. I'd probably do some treatments to help me have a better quality of what life I have left, but I probably wouldn't do the full gung-ho thing. I've told my family that. They're aware of that, and they respect that. It makes them sad. They don't like I talk about it, but it's the reality. And I am a firm believer that just because you can doesn't mean you should. And I don't think patients realize that because they get pressure from their healthcare professionals, they get pressure from their families, their friends, society, that they should do whatever it takes, that they should do what is required or recommended by their healthcare professional. And I think that they forget they have rights, and those rights are they can choose for themselves what's best for them. And again, we're not the ones to judge. We're not the ones to make them feel bad about their decision. We need to respect it, and we just need to make sure that whatever we've discussed with them, we've documented it. So we have covered our bases. They say that they have been educated, that they're aware of their decision and what repercussions might come. But you've done your job as a healthcare professional, putting it all out there, helping them understand what their choices are, and letting them make the decision because it's their right to. So in order for healthcare providers to do their side of the patient's rights, you need to make sure you're presenting them and offering them everything you can, everything you know, in whatever regard it is, and document it so that they can't come back to you at a later time and say, I didn't know, I wasn't aware, etc. But you have to make sure that you are allowing them to make the best decision on the information you're giving them. And again, this all goes back to the patient responsibilities, assuming that they're being honest with you and you have the full medical history. And that's how it all kind of ties together. So just keep in mind that as a healthcare professional, you got into this because you wanted to help people, but you also have to acknowledge the fact that people have the right to make their own decisions for their own bodies. And even if you don't agree with it, you're going to support them, you're going to help them in whichever ways you can, and you're going to be ready to answer any questions that might come up. And they might change their mind and it might be too late, but hopefully you've educated them to let them know that there's a point of no return with these decisions, but maybe there is a place where they can still an opportunity to turn this around and choose what you've suggested. So, just be empathetic, be straightforward, and, you're going to have patients of all kinds with all different things, and that's okay. That's what you got into this for. You want people to be independent thinkers. You want people to make the best decisions based on the education you provide them, and you should feel good about that. If you have any questions or comments about patients' rights and responsibilities, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already. Please share this video with anyone whom you feel would benefit from the information. Thanks so much, you guys. Take care of yourselves. Bye-bye.